I'm Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined with Dr. Thomas Smith. He's a medical oncologist here at Johns Hopkins. He's also the director of palliative care. Hi, Dr. Smith. It's great to have you.
Well, thank you. It's nice to be here.
Great. Will you tell me a little bit about how survivorship care plays a role with patients who have been diagnosed with advanced cancer?
Yes. Well, I should also say, besides being a palliative care doctor, that I'm a breast cancer doctor.
Okay.
And have done that for 25 years or so. And we've learned in treating people through chemotherapy that we have to make them get up and go. That structured exercise, no matter what it is, helps people get through the adjuvant experience. Well, it turns out that that works just as well when you're going through treatment for metastatic disease. Even though you may feel fatigued, tired, not up for it, you'll do much better if you get up and go a couple of times a day. I have my patients walk for 10 or 20 minutes a couple of times a day during their radiation therapy, during their treatment, as long as they can. Helps keep their spirits up, helps keep them from getting depressed, puts them in connection with the outside world, which as you get sicker and sicker, you can get less connected with the outside world. It's really important to try to maintain normalcy for as long as possible.
Are there other tips that you would suggest to patients beyond exercise for staying healthy for as long as possible?
Watching for depression. Depression's very common in normal people, but common particularly when you're sick. And so if you start losing interest in things, start not having anything to look forward to, you or your family should think, is this person depressed? Because that's very treatable. Other things are to eat a relatively good and balanced diet, not going overboard on any one thing, trying not to be too restrictive, but eat for comfort. Try to get those calories in to maintain.
What should a patient expect with advanced disease going forward?
Oh, everybody is different, and lots of well-meaning people will tell them about this person who had such a terrible experience and that person who had a terrible experience, and just live your own life. It's important to establish a trusting relationship with your doctors and nurses so that you can troubleshoot with them before things get bad. So if you have physical symptoms, pain, shortness of breath, depression, anxiety, nausea, vomiting, constipation, diarrhea, fix those things before they get to be a main problem. But also try to plan things that are really important. I'm increasingly stressing that anytime anyone is diagnosed with a serious illness, whether it's bad emphysema, bad heart disease, or metastatic breast cancer, they should think about a will. They should think about a living will and advanced medical directives. Should think about what's important to you. What's important to you as a person? What do you want to do in the time that you have remaining? And think about a life review. What's important that you've learned in your life that you want to transmit to your kids and grandkids and their grandkids? Write it down, talk it up, pass it on, make DVDs of yourself. All things that we tend to say, well, we'll get around to it, and then you don't have the energy, it's too late. Do it when you're still well.
And so perhaps when you have the energy to partake in these types of activities.
Do that life review when you still have energy and are feeling relatively well. So organize that scrapbook and put some names and faces on your pictures so that your grandkids won't be trying to figure out who they are. And record yourself doing stuff that you love. If you're a cook, write down your recipes for gosh sakes, but why not have somebody tape record you cooking what you really enjoy? Because there may be some tricks that you can't write down. Or if it's gardening, or if it's writing, or whatever, just have somebody record you for posterity.
It sounds like that's really key, and that patients shouldn't put off what they can do today and wait till tomorrow, and they should take advantage of things when they still feel well now. Is that right?
Take advantage of every opportunity today. Just don't put it off tomorrow. Even if you don't have the energy, typically once you get started, you'll feel such a rush of energy, you'll get farther than you thought you might. The same with exercise. Even though that may seem like the last thing you want to do, if you can put on your coat and get out the front door even if it's only 50 feet down the lane and back, that's better than you did before.
Mm-hmm. I occasionally get questions from patients about wanting to know about when treatment should stop. Do you have tips or suggestions about when patients may want to forego the next round of treatment?
Well, I was almost going to take you to task for talking like an oncologist for when should treatment end.
Okay.
Treatment should never end because we can always do more. Sometimes medical oncologists will say, well, there's nothing more we can do. That turns out to be pretty false.
Mm-hmm.
Treatment includes paying attention to your symptoms, paying attention to your mood, paying attention to getting you up and going, paying attention to spiritual things, paying attention to family things. The other time people should seriously think about stopping chemotherapy is when the cancer has grown through 3 successive chemotherapy programs. The problem is that the cancer will become progressively more resistant the more treatments it's grown through. So the chance of a 4th or a 5th treatment helping is slimmer and slimmer, and the side effects will be more and more. Those aren't hard and fast rules, and it's different for people who have different targeted therapy options available. But when you're spending most of your time in bed or chair, or when the cancer has grown through 3 different consecutive programs of chemotherapy, it's time to seriously consider stopping active chemotherapy treatment. That's not stopping treatment, but it's time to consider stopping active chemotherapy treatment.
When do you recommend for hospice to get involved?
Well, we're trying to change the way oncologists, patients, and families think about hospice. I can sometimes see my patients physically recoil when I mention hospice because it means that they're going to die from their disease. That's how we associate hospice. The real fact is that people who use hospice have their symptoms controlled better, and they probably live longer rather than shorter than those who don't use hospice. It does still mean that their life is going to come to an end at some point, and we want to make every day count for as long as possible. I'm encouraging people to talk to hospice when they might have 3 to 6 months left to live, when they're still up and going and on therapy. That way you can actually interview a couple of hospices, figure out which one's best for you, figure out which one works best with your doctor and hospitals, and actually find out what services they provide. Some hospices will actually work with your doctor and you while you're still getting chemotherapy. Others won't. Don't wait until your cancer has grown through 5 progressive chemotherapy programs and you're in bed all the time. Because at that point you probably have days to live. And it would be much better to get hospice involved early so that they can help you with your symptoms and help you plan for what's going to come later.
You mentioned not just the patient, but the family members as well. We know that cancer is a family disease. Can you talk a little bit about how friends and family can be supportive during this very challenging time?
Yes, there are a couple of ways family and friends can be supportive. One is actually to get hospice involved sooner, because relatives who have hospice involved in the care of their loved one do much better afterwards. Because hospice offers some bereavement service. They offer somebody to look after you, which not everyone has, a church or a synagogue or a temple looking after them, so they can provide some support afterwards. I think the best help families and friends can give is to ask the person, what would be most helpful to you at this point? It may not be another frozen casserole.
Yep.
It may be, can you pick up my kids from school? It may be, I haven't talked to my pastor in 2 weeks and I'm a little afraid, could you maybe make that connection for me? Or I'm having a hard time discussing what's happening to me with my family. Would you mind putting me and my family together and helping with the conversation? Those are a lot different and more difficult things than bringing another casserole, but they're a lot more meaningful.
It sounds like it could help the whole family unit, not just the patient.
it could help the whole family adapt to what's going on. I talked a little bit about the life review and DVDing. Another thing that's really helpful, I think, is for the person to write out notes, particularly if it's a younger person. Maybe their kids, maybe she won't get to see her kids graduate from high school. Well, take the time to write out some notes for those important events, and write out some notes for when they're going to go off to college or maybe get married or start their first job. Just take the time to do it while you're still well, and your kids will cherish those for the rest of their lives and pass them on to their kids.
Dr. Smith, thank you so much for being here today. This has been very helpful. Thank you for joining us.